And so today we're going to continue from yesterday's webinar by exploring how to recognize and respond to those social determinants of health during real world patient encounters. And so, as we learned from Lisa yesterday, social determinants include things like safe housing, food access, reliable transportation, health literacy, and employment and income. And all of these unmet social needs directly affect patient outcomes, whether they're telling you or not. That's why these conversation starters are so important. They're going to affect how they take their medications, whether they show up at your appointment, how they manage their chronic care disease or their chronic condition, and overutilization of the emergency room in the hospitals. They're going to be going to the ER unnecessarily. And then this largely impacts their trust and satisfaction with the system. But the good news is that you can help. And truly, this really ties the importance of social determinants of health back to patient care. If we don't address housing, transportation, literacy, your medical advice may not be followed. And remember, we're all being judged on the quality of our care in a medical practice. As we mentioned, these result in missed appointments, et cetera. Lisa had shared that 80% of health outcomes are influenced by SDOH. So you should have a plan in place to address these things. Hi, Sherry. Good to see you. So we want to begin with simple, non-judgmental scripts that your staff can use to start the conversation. And remember, we're emphasizing a tone of curiosity over interrogation. Don't just say, "What do you need?" or "Why couldn't you get to the appointment?" Because you're going to be, it's not a very productive conversation. You want to use these types of quotes here. What is getting in the way of managing your health right now? Have you had trouble getting to appointments or picking up your medications? These are open-ended, compassionate questions that your team can use to really get to the root cause of what's going on in their lives. And these questions can be used by your medical assistants, they can be used by front desk staff, or your providers, depending on your workflow. But they're meant to empower and not shame your patients. Personally, I hate asking for help. I don't like asking for help at work, home, or at the doctor's office. And so when there's something in place where I'm being asked questions that can help me and help my processes, I am so grateful for that. And your patients are going to be grateful for that too, especially with all of these added social issues that they're facing. Sometimes it's just about where they live in a community. So these questions will really help to understand that more. So here I have a list here of some conversation starters that we can use and focus on. And so I'll just go over a few of these, but your patient might say, and this is what you're hearing in the exam rooms or on the phone, maybe it's in the waiting room or at the front desk check-in. Patient says, "I had trouble finding a ride to get here." Your staff should be equipped to say things like, "I'm really glad you made it in today." So what would help, would it help if we looked into transportation options for future appointments? We may be able to connect you with a local ride program. Can I have someone follow up with you? So each of these responses are addressing a particular social determinant of health. And each response should do three things. And even if you just train your, "Hi, baby, good to see you." Even if you just train your practices on these 3 points, you're going to validate the patient's experience, right? "I'm really glad you made it in today." Offer a non-judgmental pathway to help. Would it help if we looked into transportation options? And then ask permission for follow-up or to refer them. All of this allows the patient to have that dignity and understanding that you're showing them that grace. So I won't go over all of these, but I'm definitely going to give you a copy of them. I just think that each one of these responses, however they're termed, it's going to be very important to meet those three key points: validation, offer non-judgmental pathway, and ask permission to refer. And so there's some very simple screening tools. Lisa shared the Prepare toolkit, which I'm not sure if you guys use. Do any of you use Prepare in your practice? It's the protocol for responding to and assessing patients' needs, patient assets, risk, and experience. So Prepare. Does anyone use that in their practice? Just feel free to unmute, or you can answer in the chat. So just so you know, this is a nationally recognized tool. And again, Lisa mentioned that in her program yesterday that Connect IE uses this to identify support that's available to your patient. You can do the same thing. Or train your staff. We can certainly train your staff on how to use the platform, and have the patient complete the Prepare form right there in the screening tool. And so you also can embed these into your new practice or new patient packets. So you're asking them at the visit or as a part of the intake. Maybe the front desk distributes that form at check-in, or you have your medical assistants ask one or two of the key questions during the rooming process. It's just going to allow you to screen what's happening without adding a lot of time to the provider's visit. We're wanting to save time, not waste time on these types of forms. Once the form's completed, you want to have somebody that reviews those forms and then escalates the needs, whether that be your medical assistant or a care team, ensuring that those needs are identified just through that basic script. And again, I'm going to give you all of these assets after the call today. So you want to use screening tools, again, like Connect IE or local resources guides, or just a simple thank you for sharing. We may be able to help connect you with support. Would you like help with that? May I follow up with you? That's the most simple phrase that you can use to help support your patients. And then, of course, you want to document and track all of these for your quality, and then ensuring that SDOH needs are met within those care gaps. Has anyone used this form before? I mentioned it, but this is kind of what it looks like. This is the paper form. It was developed in 2016. So not super old, but obviously came at a time where we were seeing the needs, especially in Riverside County. Do any of you use this form in your practice? Prepare. Or some version of this. As I mentioned, you can have a simple form that you use that addresses some of these areas in your practice. Do you use any sort of form like that? Well, if not, I'm very happy you're on the call today, so I'm going to give you all kinds of goodies after today's office hours. So one of the things that you're going to get today is the full Prepare toolkit, which has a lot of these pieces in there. And also, I wanted to mention that the Prepare form, which I'll give you a link to, it's at prepare.org. That form specifically comes in so many different languages. So especially if you're seeing that one of the social determinants of health is language barrier, you can have them complete a form that's in their language that is much easier to digest versus, having an interpreter potentially, or working with your team to get those answers. The Prepare form defines and documents the complexity of your patient. It helps to target that clinical care, and then it helps to understand what services they need, as I mentioned with Connect IE. It also helps the providers demonstrate the value you bring to patient. Let's talk about that just specifically for a moment, the value you bring to your patient. Imagine if your patient walks in expecting that they're just going to get bad news in your practice every day. They're less likely to come. They don't want a new medication. They don't want to have to pay their copay XYZ. But if you are a resource hub for supporting their everyday social determinants of health, you are going to be a godsend to these patients. So this really does help your provider become better providers for their patients. In yesterday's webinar, Lisa mentioned that she had a diabetic patient and she showed us all of these valuable resources based on your patient's conditions. And I thought, wow, I mean, what an amazing way to build a community for that patient who's experiencing those problems. We also went to an IEHP dinner at one point, and they shared that they have an entire community location that has um, free like education for patients. It has free workout classes. There's like mommy and me groups. And from those groups, they've built friendships, and they go specifically to learn about their diabetes or take a Zumba class so that they can see these friends. And I thought, wow, what a great way to build a healthy community is introducing like-minded patients to each other that are experiencing the same struggles. And so Connect IE can do that. If you're referring to a community resource, they have classes that can help Maria manage her diabetes. And then, oh, meet Jennifer or, you know, Sarah, who also have these same issues, and now they become a little friend group. I just thought that that was so heartwarming and such a great way to bring your patients together. And then, of course, it advocates for change at community and national levels. We want to make sure that we're keeping track of these things so that we understand what resources are needed in the community. So you're doing a service not just to your patients that walk in the door, but to all of the people in our communities.